Thank you for joining the meeting for the Saudi Critical Care Trials Group. We thought today to talk about writing manuscripts, give some tips and discussion about good things to do for writing manuscripts and things that we should be avoiding when writing a paper. So what I'll do, I'll be practical in this presentation, and I would like to invite people to have comments and discussion at the end. This is not meant really to be a lecture, but rather to be giving some practical points that might help in writing papers. So why do we write manuscripts? We write manuscripts to disseminate information, to share ideas, discoveries, perspective to broader audience. Sometimes we do it to meet job description. Certainly, a lot of us write papers because it helps in achieving personal satisfaction, and also it helps in getting grants and fundable track record. So before writing, if you want to disseminate information and give information to the others, writing paper requires that you do adequate and compulsive pre-study preparation. So before writing paper, you should be really knowledgeable in the topic you are writing about. Critically read successful papers on the same topic. It's very important. Otherwise, your paper doesn't add much. The whole idea of writing paper is to be able to add to the literature and start where the others have stopped. But to write things that have been already written, it doesn't help. So read carefully other papers and critically, because that helps you in writing your own paper. Then develop the study question and hypothesis for the paper. That's very important. The most important part in writing the paper, or first initial step, is write clear objective, clear study question. Very often people start to do things, but they have so many points they try to address. It doesn't work this way. You have to have a very specific question. And we'll talk about this when we talk about the objective, and it preferably should be in the PICO format. Should define the population, the intervention, the comparison, and the outcome. Should be very clear. And I think as a very important role, we should conduct the study at the highest scientific and ethical standards. So as general tips, we need to adhere to scientific and writing ethics. So very important that you have proper approvals, IRB, have consent whenever this applicable. Clinical trials should be registered. Systematic reviews now need to be registered. Large observational studies preferably should be registered. These are all will improve the quality of the paper and enhance the ethics of the study. We need to be very careful and familiar also with misconducts in medical research. Plagiarism, which is taking parts of other people's work, taking sentences, paragraphs, verbatim, copy-paste. This is a big no. Never do it, okay? So you should use your own language. Falsification is some of the data we don't know, so you just approximate it or make it up. Is big no. All the data should have original, should be traceable to primary source. Falsification is not acceptable at all. Fabrication is to make up the study completely. This is big problem. Authorship fraud, to have people on the paper who never done anything in the study, and obviously conflicts of interest. Conflict of interest should be declared. The conflict of interest does happen, but should be declared carefully in the paper. So when you write a paper, you need to write it clearly. Write it as if you are describing this to a friend. Okay, when you are sitting with a colleague and try to explain your idea, describe it exactly the way you mean it in specific and concise terms. And write the paper as a patient-centered, not number-centered. Try to make it around the patient, not around a drug, not about a hospital, not about disease. It's about patients. So papers flow better if they are written around the patients, so patient-centered. Also avoid emphasis of statistical significance at the expense of clinical significance. Sometimes we see differences, see some p-values here and there. Don't write about p-values. People don't, this is not appreciated at all. Try to be clinically significant, focus on the clinical significance. So if the intervention make some difference clinically, but it's statistically highly significant, don't try to overemphasize it, put it in the proper context. But this is really matters to patients. Next step is to write for readers and not to please peer reviewers. Write as if you are talking to an informed colleague. Write as if you are explaining a new technique for an experienced research technician. The writing should be clear, very clear. You are trying to convince people about your findings. So what are the parts of the manuscript that typically in a paper? This might vary from one journal to the other, but generally would include title, abstract, introduction, methods, results, discussion, and conclusions. So the title, good title would be a short and concise, should be easy to understand, and gives accurate idea about the methodology and content. For scientific paper, please note, you are not writing for a general newspaper, okay? So it doesn't have to be flashy, it doesn't have to be exaggerated. It's here we need to describe the information scientifically. So it has to be very concise and specific. Some journals will request to have the study design in the title, but not all of them. Poor title is a misleading, is non-specific. If it's also used the same sentences as in the text. So I took an example here. I just added this to the presentation from a paper that we participated recently in the New England. I could see very specific title, interleukin-6 receptor antagonist, and critically ill patient with COVID-19. It tells you the intervention and tells you the patient population. Very specific. Doesn't tell you, for example, interleukin-6 receptors are highly effective in critically ill. It doesn't say this. Okay, so very specific information. Doesn't exaggerate the findings. Doesn't try to be too flashy, but it just gives specific information. The abstract is a summary of the paper. It states the objective clearly and concisely. It has to be short, but it should give the key information and doesn't exclude key information, and demonstrate the findings, that the findings are important, and the study should also, when I read it, get the impression that the study was carefully done. That will be a good abstract. Poor abstracts, if it's inconsistent with other parts of the manuscripts. The results in the manuscripts are not really same as in the main paper, or they are different from what's in the table. This will be big red flag. If it's copy pasted from what's in the body of the paper, also is not a good practice. This is not a good abstract. Here I copy the abstract from this paper. It's brief because journals will require that you have certain word count. I'm not going to read this abstract. You could go back to it. You could see the background is one sentence only. So the introduction, whether in the main paper or in the abstract, are really brief. There is information, reasonably good amount of information about the methods, because you want to show how the study is done, the key findings, which are mainly the primary outcomes. So don't put a lot of different outcomes. Don't try to show the ones that are significant in the abstract. You have a primary outcome. This is what should appear in the abstract. Not every significant p-value should be here. And conclusion is brief. We'll go to the main body of the paper, introduction. So good introduction is so important. Bad beginning makes a bad ending. Is when I start to read the paper, the first few sentences give me the whole impression about the writing of the whole paper. The beginning is the last chance the reader has to put your book or article down before they start to hate you for wasting their time and money. So writing good introduction is so important. And I've read a lot of papers where the introduction clearly deviate a lot from the objective of the paper. So the introduction is not a general review of the topic. Remember, it's not a general topic, not general review. Good introduction, you have to show me why the study, this particular study, is needed. It should summarize previous work and convince me why the study is needed, why the study is needed. Also, it should have the study objective. So the introduction is not general paragraphs. It has to be very organized. Previous work, and based on this previous work, so the previous work has limitation, did not answer the question, so this study is needed because of X and Y and Z, and therefore we are doing this study. So let's go through this abstract. So this is the introduction from this paper about IL-6 antagonist. First of all, you see how brief. It's not like 2 or 3 pages. It's barely half page, short. So it gives background, nature of the problem. COVID-19 is a problem. Steroids been used. Interleukin is part of the response. Tocilizumab has been used in X, Y, and Z, and it has been described in COVID-19. Then it moved to the second part, which is the gap. So it has been used, but the studies are negative. Most positive studies showed no difference in mortality. So now you show me the previous work and how is this, I'm trying to move you to why my study is important, what my study adds to this. So previous studies did not show effect on mortality. So this is a gap. And then, in other words, this is why further studies are needed. Then the objective. We investigate the effectiveness of tocilizumab and sarilumab on survival. So we have the intervention, we have the outcome, we have the and population. So good introduction goes right to the essence of the problem in order to focus the reader attention. So if I'm writing this on IL-6, I will not write pages on COVID-19 and how COVID-19 pandemic has happened, or history of COVID-19 or coronaviruses. This will deviate readers completely. Don't need to write a lot of discussion about inflammation or IL-6, what's the role of IL-6. This could be one sentence. So it has to be directly, I'm interested in what's the effect of IL-6 on organ support, 3 days, and mortality. So let's focus on this. It should provide adequate background supported by the literature. and use references carefully. You need to show me that you are actually updated on the topic. So if you put references that are really not important, secondary important, and you miss the key references that are known to the experts in the topic, you put me off completely. So using references carefully is very, very important part of the background information. Also, it defines the terms used in the title as needed. Good introduction is short, and much of the introduction should be written in present tense because you are describing what's been established and what's at the state of the study, at the start of the study. So at present, what's the situation? The study objective should describe the purpose of the study clearly in a manner analogous to 15-second summary of a patient case. When you go to the bedside, you ask your senior fellow, what's the patient condition? He will tell you 75-year-old patient with septic shock during pure sepsis. Very short, but it's very descriptive of the patient condition. Here, the objective of the study is to examine the effect of sirolimus and tocilizumab on mortality in critically ill patients with COVID-19. Boom, it's finished. This is the objective of the study, very clear. So poor introduction is an introduction that is not reflecting the importance, novelty, originality of the study. It's not intriguing, boring. It's just, okay, COVID-19 started in Wuhan, China, and now it's like 50 million, whatever number of cases, and has spread in another, and this and that mortality. Okay, it's a big lecture on COVID-19, which most people know by now. It's completely unrelated to the topic. Long and indirect, and then goes from COVID-19 to the inflammation in COVID-19, then from COVID-19, IS6 is important. No, you don't need to do this. You should go direct. So long and indirect, the study question, hypothesis, study objectives are not specified. The study's objective, question, purpose, objective, hypothesis are confused. You think this is not common, they are actually common problems. This cartoon from a book on writing papers. Dear contributor, thank you for submitting your story, your article. We regret that it doesn't suit our present needs. If ever does, we are in trouble. Methods section. Methods is so important. People don't pay attention to the methods, but it is really the most important part of the article. If the methods are right, the results are valid. If the methods are not correct, the results are not valid. The greatest invention of the 19th century was the invention of method of invention is methods. So describing how you did your experiment, whether it's bedside clinical experiment or basic science experiment, is so important. So methods describe the experimental design enough detail so a competent worker can repeat the experiment. For the study to be of scientific merit, it must be reproducible, and to be reproducible, you should give enough information so I can repeat it. A good reviewer will read methods carefully. I review many papers. Reviewing the methods is so important. Most of the comments are really not about the discussion, not necessarily about the introduction. There will be some changes, but the most serious comments will be about the methods. And if the method section is confused, then the whole paper is confused. If there is serious doubt that the experiment can be repeated, the reviewer recommends rejection, or your manuscript will no longer be inspiring, no matter how the results are inspiring. In the methods, you should give full details. So people try to, and I'm reviewing paper now. I'm so angry because it's not transparent. It clearly the reviewer the author tried to hide some information about missing values, about what variables he adjusted for. You need to give all these details, otherwise the interpretation of the results are not valid. Most of the sections should be written in the past tense. This is how you did your study. So good method section gives full details, should be organized in a meaningful way. And we'll talk about this in a minute. It should describe all aspects of the study design. How's the data, how the data were collected. Describe data collection details. Who, what, when, where, how, why, who collected the data, what data was collected, when was it collected, where was it collected, how, and why. Justify why variables were selected. Define all your variables and provide reproducible details of the statistical methods. So good method section will include settings. So we'll start where the study was done. Okay, settings, where the study was done. So we'll start with hospitals, wherever, the hospitals. Then we'll move to the subject, to the patients. Then what did you do to these patients? Procedures. Then outcomes. This is kind of logical sequence. Don't mix them up. It should have a nice flow. So start with the hospital. The hospital has patients. The patients, we treated them, we gave them procedures, and we looked at outcomes. And then you discuss your sample size and statistical methods. So settings is where the study was done, the length of time covered by the study. So if, let's say you are doing a COVID study, it's so important to tell me where is it done, because we know the outcomes differ from one place to the other. You have to tell me really when the study was done, because a study done in the beginning of pandemic would have different outcome than a study done towards the end or now at this time. Outcomes are different. So the length and the time of its being done. Who are the subjects that were included? Did you include patients who are outpatient? Did you include patients hospitalized on the ward? Did you include patients who are admitted to the ICU but not intubated? Did you include intubated patients? Did you include what? I mean, we have to define clearly the inclusion-exclusion criteria. How this, then when we talk about the subjects, inclusion-exclusion criteria, and if this study randomized, how randomization was done, how patients were followed up, what's the follow-up? Then the study procedures, define the measures used in the study, especially if some of the interventions were developed by the investigator. You've done some procedure or intervention that is not standard or not known, you have to describe it properly. You did the study in a certain way, then you should describe it because other people don't know it. If unusual instruments or methods were used, you should provide a reference or a brief description. You could, for example, if you provide this information, the reader may or may not agree with your definition, but at least they can make their judgment about how you defined these methods. For materials, if you use certain material, you use certain drug, you use certain supplies, you use certain equipment, you should include the exact technical specification and the quantities and source of method. So, I mean, we did the helmet trial. We have to say, helmet, what type of helmet? There are so many types of helmets. It will not be the same. It could not be this, may be different with other products. If you're certain you use the unusual mode of ventilation, you should describe this mode of ventilation and what ventilator was used, for example. Okay. Outcomes should be clearly stated. You should state what's your primary outcome. People sometimes give list of outcomes, but don't define which one is the primary. We should define what's your primary outcome. You focus on your primary outcome. The rest are secondary outcomes. Some outcomes are relatively simple to assess, such as mortality. Some are more challenging, such as functional outcomes. Then these will need to be defined properly. You should provide me with reassurance that the assessment of the outcome was reliable. So if your outcome was done in, you looked at quality of life, what's the, how is it done, by who it was done, how, what's the tool that was used, etc. So poor method section, if it's methods that are reported are not actually what's been used, maybe suggesting a template method taken from other paper. If the details of method, sometimes people write method, but it's really superficial and doesn't describe what's actually being done. This will be not a good thing to do. So methods has to be sufficient details. Next section is the results. Results section, good results section should provide data in a natural order. In a natural order. So natural order, you start with who are your patients, then what you have done to them, and then their outcomes. So we start with describing our patients, characteristics, baseline, then what interventions and co-interventions were done, and then the outcomes. Will start with the primary outcome because it's the primary, and then the secondary outcomes. And then we'll go to the other analyses like subgroup analysis, etc. later. So a good section, result section, contains the findings directed at the question posed in the introduction. Remember, you have an objective for the study. So the results section should address the objective of the study. I should feel when I'm reading the paper that the whole paper is trying to address this main question. Should present statistical information appropriately, should be comprehensive and convincing. So good results section present data for similar variables consistently. Uses well-designed tables, graphs, flowcharts, histograms, and figures, and summarize and cite these in the text. The tables should be used and should be nice, should be clear. They should be simple and self-explanatory, and they should not be repetition of what's written in the text. So not everything written in the table should be repeated in the text because that's not needed. Should use consistent format. The table should be similar to each other, similar layout, and all the terms should be clearly defined. Provide units. If you write bilirubin, tell me which unit. Creatinine, what's a unit? Age, what's a unit? Age is in years, right? Length of stay in days. So this is unit, should be provided in all variables. Include clearly written legends for each figure. Each figure should have explanation. This is survival analysis for the two groups in the study data. So it should be very clear explain what's in this figure or the table. In writing results also provide, the results should give me a clear idea about what happened in the study. So provide a flow diagram, consort diagram, especially for randomized controlled trial, of the patient flow in each stage of the study. How many patients were screened? How many were excluded? How many were randomized? How many were in this arm? How many were followed up to the end? How many lost follow-up? And so this would summarize efficiently the study design. So this is a flow diagram from one of the studies. How many screened, how many eligible, how many enrolled, how many randomized, how many in this group, how many in this group, how many received intervention or did not, how many contribute to the primary outcome. In writing results, you need to describe the characteristics of each group to ensure that what we just described, screened, excluded, eligible, not randomized, did not complete outcome, loss of follow-up, completed entire protocol. By reading the results, I should get the impression that the sample group represents the population as a whole. We need to get the impression also, or should show us that the randomization was successful if this randomized controlled trial. So the study groups in the baseline table were balanced or not. If it's an observational study, you should show me whether these two groups different or not. Describe the duration and nature of follow-up. Also provide if there are observations based on judgment, such as two observers looking at certain outcome, provide assessment of consistency of agreement between the two observers. If this is a randomized controlled trial, it's essential that you provide information about how the study patients adhere to the protocol and how many deviation on our observation. Even if it's observational study and you're describing intervention, you should provide information about how many of the patients actually got the intervention and for how long, etc., and why patient did not receive it as well. Report all potential treatment-related side effects and adverse events. For the main results on the outcomes, we report the results. X number of patients died out of this number in the group A, and this group B. And this is the relative risk, which is the change between the two groups. Report 95% confidence interval for the endpoints. We report actual p-values for all primary analyses and report statistical findings in enough detail so to allow reanalysis or meta-analysis. Very often, especially in observational study, there will be potential confounding or interactive effects. This should be also reported. Some things that we should avoid: poor results section. Results are omitted, not provided properly, either intentionally, because you don't like it, so you don't report it, it's not acceptable, or unintentionally. If the study results do not account for all study subjects. So I'm reviewing a paper today for one of the journals, and the patients, one of the groups should have 55 patients, for example, and the graph shows 49 patients. So it doesn't account for all study subjects. So this tells me that the authors are not careful. They did not say that we have missing data. So they are simply not careful. Numbers in the paper is not consistent. In one place says 55, another place 49. This will be a big no. Categories equal or more than 100%. You should have 55 patients. What we have, you add males and females, they add up to 56, for example, or the died and survived add to more than 56 or less than 56, whatever, less than the total number. They don't add up. So how do we solve this issue, or how to be careful about it? I think it's so important that the numbers in your study are consistent with the flow diagram. You have to double check all your tables, text and abstract. Sometimes we write and revise and change, so the numbers may change in different places in the paper. You need to make sure that the numbers across all parts of the paper are all accurate and consistent. Poor results section, inconsistency between information presented in tables, graphs, and the text, as I said, and or abstract, for example, which for me as a reviewer or reader tells me either this is typos, which is not good, or that the authors analyzed and reanalyzed and rewrote the paper multiple times, or they are simply not careful in their procedures. And that's all these will not give good impression. Poor results section, if you report the results by the analysis by treatment. So the patient who did not receive the treatment were removed from the analysis. This is a big problem with observation studies, obviously, but in randomized controlled trials, always the treatment should be, analysis should be by intention to treat. Discussion section. The good discussion section starts with the most important point. And the most important point is what's the main finding. So, so this is where I start. The good discussion section confines the discussion to the study results. Again, the discussion section is not a review article of the topic. It is actually discussing your results and compare your results with other data in the published literature. How does it contrast with it? How do you put it together with other papers? And provides practical information and emphasize new information in the results provided. It's not meant to be literature review of what other people work, not at all. It has to be focused. It has to discuss the implication of your finding, should consider other explanation for the results if they are appropriate, and discuss clearly limitations to your study. Poor discussion section, if the logic is loose, just reads as a flight of ideas, no clear direction, just listing other people's work. The content is too expansive and wanders from the results, which are not uncommon. People write discussions that are completely not focused. Presentation is biased, too much emphasis on the p-values and significant findings, but omitting key findings from other investigators. Key results are not clearly explained. If the references that are given are really not the key references for the topic, not the most updated or the critical references, or the references were misrepresented, were given misquoted, for example. If the investigators give speculations and don't say this is a speculation, they try to over-interpret their results and overstate the findings. All these will be not that good. If the study limitations are not described, you always better to put your own limitation. If you don't do it, the reviewers will find them and the readers will find them. If you have inconsistency between your discussion, introduction, and the results, always remember what's your the study objective. The study objective is to look at this on this outcome in this group of patients. So the results should follow this and the discussion should follow. When you have inconsistency between different parts of the study, sometimes I see this, people have an objective, and when you go to discussion, it talks about something they just deviated from the main objective. So good habit to always refer to the introduction and briefly review the purpose of the study before you write your discussion and conclusion. Poor discussion section is when you start to extrapolate beyond the data that is analyzed in the study. We are giving conclusions based on measurement not done in the study, or conclusion that require longer period of time, or the results, you try to generalize the results beyond the group of patients that are studied in the article. Study conclusions. Good conclusions are clear and strong. Strong meaning reflect the study findings, fully supported by the results presented, but they are at the same time limited to the boundaries of the study presented, and they describe any further research that should be considered. So they are clear, balanced, and focused. Poor conclusion section, if it's restate the results or doesn't answer the study objective. We have a study objective, the conclusion should address the study objective. If the conclusions also do not set limit for application, if the conclusions are overstated, beyond, so you've studied certain drug in critically ill patient, you cannot generalize it to all patients. For example, you select for certain group patients, do not overgeneralize it. So before submitting your paper, it's always essential to update the literature review. There may be a new paper that has appeared. That will be good that you include it. Be comprehensive in evaluation of the literature to date. Try to include only relevant recent papers. Do not include just, you don't, the list of references reflect your knowledge about the literature. So if the studies are old, they are not focused, they are not critical in this topic, that gives an impression that you are not really knowledgeable about the topic. So you should also you should quote primary resources. Do not quote textbooks. Do not quote, typically, do not quote review articles, with some exceptions, but generally, you should quote primary resources. Sometimes we quote review articles or textbooks, but that will be in specific conditions. Primarily, you should quote primary research. Misspelling is not a good thing. Incorrect formatting, typos will just deviate and provoke the reviewers. So proofread the final version for logic, accuracy, flow, spelling, grammar. And it's always good to give it to a colleague to review it, to also improve the language. So the language and grammar, etc., is also important. The capital letter is one of the common problems. Capital letter issue. Sometimes people put capital letter in the middle of the sentence and they don't put it in the beginning of the sentence. Okay, when you get a reply from the journal, how do you reply? Always thank the reviewers in your reply for their input and acknowledge their value, the reviewer value. Do not ignore their requests. The reviewer I spend so much time on reviewing papers, and some of the comments will be critical and critique, but they will help the reviewer, they help the authors actually, because I'm giving an external eye to the paper. So do not ignore it. Do not ignore the review comments. Either you comply, you say, I agree, and we comply with it. But if you think they are not justified, you just give your reason, scientific reason, why you think it's not needed. Dear contributor, we have received your latest manuscript. Why did you send it to us? What did we do to hurt you? So why manuscripts fail? Why manuscripts are rejected? Could be technical reasons. Sometimes people send to the journal that the journal is not really, this is not their area, not within the scope. Or the authors did not follow the instructions to author. It's important. One of the things that put off the journals, if the manuscript was submitted to the previous journal and the author just took it and submitted as is, and it's clearly in the format of another journal. unclear purpose, poor syntax, extremely verbose, too much text, flight of ideas, as we said. All these will be reasons for rejection. Of course, ethical reasons about the study or even the study question. Paper of low priority, really not a really good topic, not important topic. If the author is unwilling to revise the manuscript to address the reviewer comment, you send him the reviewer and he make some superficial replies and send them back. This will be reasons for rejection. Could be more cognitive, content related. The concept of what's in the study is not unique. It's repeated work. The question is trivial, not really of clinical significance. There are some serious uncorrectable scientific flaws in the study itself. There's a lot of missing data, for example, that the authors did not disclose, did not address properly, for example. Selection bias, study underpowered, study groups, wrong study groups were studied, methods inadequate to answer the study question, results are statistically significant but clinically not relevant, or these authors try to overstate their conclusion and really did not address the study question. Finally, so what I try to do here is give some practical tips on writing papers. I'll be happy to take questions. You could put them in the chat and we'll unmute people who are interested in giving questions. There's a lot of, in writing paper, there's a lot of skills. In this, there is a raised hand, Dr. Hani. So Rose, if you can help us with unmuting, I would appreciate it. Dr. Hani, Timsah. Let me see if I can unmute.
السلام عليكم بروف. يعطيكم العافية حكيمنا.
حياك الله.
الله يعطيك العافية. Wonderful بصراحة, from A to Z, very enjoyable topic, Prof. Thank you very much for sharing this lifelong experience, mashallah. Prof, I wanted to ask about including the preprints in your discussion or references. What do you think about that one?
It varies. I think it varies from one. It depends on the topic. Mm-hmm. So the COVID-19 preprints became so relevant. So if I'm writing a paper on cutting-edge intervention, treatment, etc., and I'm submitting to high-impact journal, probably I would cite preprints that are relevant because this is the most recent literature. Now, some journals would not like preprints because they are not peer-reviewed yet. But if you put it in the right context, it might be acceptable.
Yeah, you're right. And actually, I use it a couple of times. And by the time the paper gets accepted, that preprints actually becomes a peer-reviewed published paper. And yeah, so as you mentioned, it depends on the context. Yes, Prof. Thank you.
Agree. And in reality, many of the high-quality papers that were published in preprint, they did not change much when in the peer review final publication, really. With all people critiquing preprints and saying preprints have the limitations, which we do agree to some extent, but the high impact and high quality papers, they change very little from the preprint to the final paper. So we know, I think people know which ones are good and which ones have issues.
Yes, bro. Thank you. Salam.
Salam. Any other questions? If you have a question, you could raise your hand. Dr. Abdullah. I'm trying to unmute, but Rose, are you with us?
Yes, doctor.
Unmute Dr. Abdullah, and then there is another doctor, but no name. It says Zoom user. You could unmute also, please.
Okay.
Doctor, thank you for the topic. الله يعطيك العافية. My question is, how many references should be there? What is the maximum and what is the minimum?
So most journals have
no
so most journals have limit number of references for the articles. So for original articles, typically between 25 to 40, depends on the journal. If you're writing review article, the number of references will be much higher, sometimes 100 or more. But most journals would, for original articles, will be between 25 to 40. So you need to be selective and prioritize which one will go to the in your reference list. You need to be selective.
Okay, thank you.
Most relevant articles. Sometimes we put references in the supplement if they are very relevant, but I don't have space for them. We move into the supplement. Thank you, Dr. Abdullah. There is another question from. There's no name, no clear name.
السلام عليكم.
تفضلي. وعليكم السلام ورحمة الله.
الله يعطيك العافية دكتور ياسين على المحاضرة الرائعة. أنا الدكتورة لينا. بس كنت بسأل what style of reference is preferred in research?
Which one, sorry?
ABA, الستايلز, الريفرنس styles. ABA, Harvard ولا?
This is differ from one journal to the other. So each journal has its own style. So for that reason, for the references, we use software, specific softwares for using references. I use EndNote, for example. So EndNote, yeah, there are other ones. So, but basically, you could change the format based on the journal. So if you're submitting to a certain journal, you could select the journal, and it will automatically flip the format. If the article, if you change, you want to submit somewhere else, it will be easy just to change the format. It will change it. So there is no unified format for all journals. Each journal has its own.
شكرا يعطيك العافية دكتور ياسين.
Yeah, always use better to use the software. Otherwise, you will struggle a lot with the references. Thank you, Dr. Lina.
Okay.
Any other questions?
Thank
you. So with this, we'll conclude. I think we plan to do a series of presentations like this, hopefully, in these meetings. We had given presentation before about statistics, but we'll try to keep maybe every couple of 2 or 3 months a topic, general topic that may help people in writing paper, analyzing results, etc. So we'll invite the different speakers and people who feel that they can help and participate and present, more than welcome also. Okay, with this, I'd like to thank you all for attending and appreciate your listening. There's a question from Dr. Saleh.
Assalamu alaikum, Prof. Thank you very much.
Saleh, alaikum assalam wa rahmatullah.
Appreciate, Prof, your talk, and it's very interesting. Would like to ask you about what drives your recommendation at the end, you know, the conclusion sometimes is, do you rely on how much the, you know, when you compare the literature's findings compared to your finding, and, you know, their limitation and how much they are far from your results. this creates sometimes the gap, and then you build up your thought that there is a future gap that need to be answered. Do you draw your recommendation from the area of discussion mainly?
So the conclusion, good question. So the conclusion. So always, I think the first thing you should write in the paper is the objective. Always write the objective first thing. So what's my objective? My objective is to examine or evaluate the association of using aspirin in the outcome of critically ill patients with COVID-19. Okay, that's my objective. So whenever I write a section, I go back to this objective. It's very important to stay focused, not deviate. Your conclusion should address this objective. So my objective is to evaluate the aspirin. So what did I find at the end? Aspirin was not associated with reduced mortality, or was associated, or whatever. So it should address directly my objective. Should the conclusion include comments on how my study compare with others? The answer is no, because the conclusion is conclusion of your study, and your study is not systematic review. So your study is not a comparison of your finding with the others. I mean, this is a kind of small distinction here. Discussing the other people's work will be in the discussion section. And that will be just to put your results in context of the others. But you are not directly comparing your findings with the others. That would require systematic review. If you are doing a systematic review and comparing studies, then the conclusion will include comparison of different studies. But for your study, for example, I just made up example of aspirin, you address, in conclusion, aspirin was not associated with reduction of mortality in critically ill patients with COVID-19, period. This will be the conclusion. Further work needed. Yeah, I think you could put a statement on further studies are needed for example, large multi-center randomized controlled trial is needed, whatever, studies with higher dose of aspirin is needed, study in high-risk patients needed, whatever you think, yeah, you could make that suggestion. But the conclusion should be for your own study and not comparison. Comparison should be in the discussion section. Any other questions? Okay, if not, thank you very much and have a good night. Assalamu alaikum.
Thank you.
Yeah, bye-bye.